The back of the neck. Let's quickly review the anatomy of the back of the neck, its landmarks, ligaments, and muscles. Let's begin. The back of the neck is limited above by external occipital protuberance and superior nuchal lines, and below by spine of C7 vertebra and horizontal lines extending on either side from it to the acromial process of scapula. The important structures on the back of the neck include Ligamentum Nuchae, extensor muscles of the neck, suboccipital triangle, surface landmarks, external occipital protuberance. It is a bony projection felt at the upper end of the nuchal furrow, a vertical groove in the midline on the back of the neck. Superior nuchal lines. These are curved bony ridges passing laterally from the external occipital protuberance. The convexity faces upwards. Spine of 7th cervical vertebra. It is knob-like bony projection felt at the lower end of the nuchal furrow. The spines of other cervical vertebrae are covered by ligamentum nuchae and hence cannot be felt. Acromion process. It is felt as a bony edge immediately above the bulge of the deltoid muscle. Soft tissues on the back of the neck. The soft tissues on the back of the neck are divided into 4 layers. From superior to deep, these are skin, superficial fascia, deep fascia, muscles, skin. The skin on the back of the neck is supplied by the medial branches of the dorsal rami of C2, C3, and C4 spinal nerves. The cutaneous nerves derived from the medial branches of dorsal rami of C2, C3, and C4 are greater occipital nerve, C2. It pierces the deep fascia. On the level with the superior nuchal line, 2.5 centimeters, lateral to the external occipital protuberance, and supplies the posterior part of the scalp as far as the vertex. 3rd occipital nerve, C3. It pierces the deep fascia, medial to the greater occipital nerve. A little below the superior nuchal line, it is a small cutaneous nerve and supplies the skin on the nape of the neck up to the external occipital protuberance. Cutaneous branches of C4 and C5. These branches pierce the deep fascia close to the midline in series with the 3rd occipital nerve. They supply the adjacent skin. Superficial fascia. The superficial fascia of the back is thick, and in spite of its fat content, it is very tough. It contains cutaneous nerves and vessels. The cutaneous nerves are greater occipital, 3rd occipital, and cutaneous branch of C4 and C5. Deep fascia. The deep fascia of the back is called nuchal fascia. It is attached in the median plane to the spines. Supraspinous ligaments and ligamentum nuchae. Extending laterally, it sheets the muscle on the back. Ligamentum nuchae. It is a triangular sheet of fibroelastic tissue that forms the median fibrous septum between the muscles of the 2 sides of the back of the neck. The ligamentum nuchae presents 3 borders. Superior border is attached to the external occipital crest. anterior border is attached to the posterior tubercle of atlas and the spines of cervical vertebrae. C2 to C7. Posterior border, which extends from the external occipital protuberance to the spine of the 7th cervical vertebrae. Muscles. The muscles of the back of the neck on either side of midline are arranged into superficial and deep groups. Superficial group. The muscles of this group are arranged into 2 layers. First, or superficial layer, consisting of trapezius muscle. Second, or deep layer, consisting of levator scapulae, rhomboideus minor, and rhomboideus major. Deep group. The muscles of this group form the intrinsic musculature. The intrinsic muscles are arranged in 4 layers, from superficial to deep. These are as follows. External layer, consisting of splenius capitis and splenius cervicis muscles. Deep layer, consisting of semispinalis capitis and semispinalis cervicis muscles. External layers muscle, splenius capitis muscle. Origin arises from spines of 7th cervical and upper 4th thoracic vertebrae and lower portion of ligamentum nuchae. Insertion runs upwards and laterally and emerges from beneath the trapezius in the posterior triangle and inserts into the mastoid process and lateral third of the superior nuchal line. Nerve supply supplied by posterior rami of middle cervical nerves. Actions rotates the head and face to the same side. Acting bilaterally, they draw the head backwards and extend the neck. Splenius cervicis muscle. Origin arises from spines of T3 to T6 thoracic vertebrae. Insertion passes deep to splenius capitis to be inserted into the transverse process of the upper 4th cervical vertebrae. Nerve supply supplied by posterior rami of lower cervical nerves. Actions turns the head and face towards the same side. Acting bilaterally, they extend the head and neck. Semispinalis capitis muscle. It is a long, thick, and powerful muscle and produces longitudinal bulging of the neck. On each side of the median furrow, its medial border is free and is in contact with the ligamentum nuchae. Origin arises from the transverse processes of lower 4th cervical and upper 6th thoracic vertebrae. C4 to T6. Insertion runs vertically upwards and inserted into the medial part of the area between the superior and inferior nuchal lines of the occipital bones. Nerve supply supplied by posterior rami of spinal nerves, usually by medial branches. Actions: it extends the head. Semispinalis cervicis muscle. It lies deep to the lower fibers. Semispinalis capitis. Origin arises from transverse processes of lower cervical and upper thoracic vertebrae. C5, T4. Insertion: spines of cervical vertebrae. C2, C4. Nerve supply supplied by posterior rami of spinal nerves, usually by medial branches. That was a short overview of the back of the neck anatomy. Thanks for watching.